Have something for you, don't leave. Good afternoon. Happy Saturday, everybody. It's chilly outside, but sunny, so hopefully a good day to go take a walk, or starting today, the parks are open again, so maybe you and your family or whoever, small network, could go take a walk. It's a beautiful day to be outside, get some exercise, and get some fresh air. Tomorrow, we will not have a press conference in honor of Mother's Day. However, Dr. Alexander Scott and I will be sharing a special Mother's Day video for everybody in honor of all the mothers in Rhode Island, with a special thanks to all the moms who have been working on the front lines nonstop in many cases for the past 8 weeks. And then starting Monday, we're going to have a slightly different format for these press conferences. They will be every day at 1 o'clock, Monday through Friday, but we're not going to have them on the weekend. So we're moving from 7 days a week to 5 days a week. Again, just recognition that we're moving into phase 1 and things will be a little bit different. Of course, I want to encourage every Rhode Islander to stay tuned in to this news. It's, the official source of news in Rhode Island. It's always fact-based, facts, not frenzy. And the next, we're going to be living with the virus for a while. The next 2.5 months or so, or especially the next month or so as we move through these phases, there'll be a lot of new information. So I would encourage you to continue to tune in. If you'd like to have updates emailed to you every day, you can go to www.governor.ri.gov. And there'll be a button there at the top of the website. You can sign up there for daily coronavirus updates. I'd encourage you to do that. Again, it's accurate information. It's based on what's happening in Rhode Island. It'll keep you informed, and I hope keep you, if not relaxed, at least a bit more peaceful, knowing that we have a plan and you can keep yourselves informed. We'll begin with the data, which is on the screen. You can see we have another 210 cases to report yesterday. So we're still, still a couple hundred cases a day. We haven't yet reached that point where we'd like to see a big decline. So I just want to remind everyone, as we today officially put our toe in the water of getting into phase 1, your goal is baby steps. Get back out, baby steps. And that means keep your social network limited. Social gatherings still limited to 5. And you don't want to be seeing a different 5 people every day. The name of the game right now, next couple weeks, phase 1, keep your social network limited. We're in a very good place. You can see on the screen, we are in a stable place. We're coming out of our stay-at-home order first in New England, in the Northeast. That's because of your hard work. We're in a stable place, but it's a tentative place. So we're going to take it slow. I only want to reopen this economy once. I don't want to do fits and starts, open, close. We're not doing that. The way to do this then is slowly, cautiously, and following the rules. So stay close to home, follow the rules, and keep your social network small. As you know, today, retail establishments can begin in-person customer shopping, new rules, fewer people in the store, keep a social distance of 6 feet, wear your masks, but I'd encourage you to go shopping. Our retailers need it. If you have some money in your pocket to spend, maybe go get your mom a gift for Mother's Day, but let's go ahead and think about getting back out there. For retail establishments who are trying to reopen and thinking of reopening, obviously you have new regulations. You have to follow those regulations. We'll be enforcing the regulations. We're also trying to help you. We want to make it as easy as possible for you to comply with the regulations. So you have to complete and sign a checklist indicating that you've reviewed our new business guidance and you feel ready to reopen. We're asking businesses to go through the checklist and attest that they're ready. You can find those new guidelines at our new website, reopeningri.com. Reopeningri.com. If you have questions about anything, if we can help you, if you think we should be doing something differently, if you have a better idea, we want to hear from you. So you can send us an email at covidplan@reopeningri.com. We want to hear from you. covidplan@reopeningri.com. We're going to do this together. It's going to be flexible, patience and flexibility. We've put out guidelines after a lot of consultation with retailers and businesses. I am sure they're not perfect, that I know. We've done our best, and we want to hear from you. So let's have a dialogue, let's do this together, and let's begin the process of reopening slowly, steadily, and safely. Tomorrow's Mother's Day. Happy Mother's Day to everybody. It's a beautiful day of the year. I just want to remind you again, love Mom, but please, no big gatherings. No, in my family, what we would typically do for Mother's Day is everybody would go to my sister's house family, friends, and there would be 15 or 20 of us around the dining room table. It's the best. We love our mom. We want to cherish her. And this year we'll find different ways to show mom we love her, because we don't want to be gathering 10, 15, 20 people at a time. I want to make a few specific announcements. The next 3 announcements I'm going to make are meant to give some comfort to the very many Rhode Islanders out there who are struggling financially. And the longer this crisis goes, the harder it is. This past week was rough. It was a rough week for a lot of people. I want you to know we're going to get through it. We're reopening. This is not the end of our story. This is the beginning of standing our economy back up and coming out the other end stronger and more resilient than we went into it. Having said that, it's been tough and it's going to continue to be tough. So I want to share a few things we're working on to give you some relief and support as you get through this. Earlier this week, the Public Utilities Commission voted to extend an order that all regulated utilities cannot be shut off or sent to a collection agency through May 31st. That's very important. So your electric, your gas, your water, your sewer cannot be turned off, even if you can't pay, and it can't be turned over to a collection agency at all for the month of May 31st. That applies to both residential and non-residential customers. So I would say if you're in a position to pay, please pay. If you're a business or a family who can pay your bills, please pay your bills. Everybody's struggling, okay? Everybody's struggling. The landlord is struggling, the utility companies are struggling. So if you can pay, please pay. Having said that, if you can't pay, don't worry about it. Don't stress about it. Your water won't go off, your heat won't go off, your electric won't go off. I don't want you to worry on top of all your other worries about having your most basic needs met. Secondly, I have another announcement hoping to provide some financial relief to the very many Rhode Islanders struggling to pay off their student loans. And as someone who had a lot of student loans for a long time, I am extra sensitive to this. I want you to know that Rhode Island has partnered with an organization called Summer, which is a student loan advisory service. Summer's specialty is enrolling borrowers into loan assistance programs. And I'm excited to say they're now offering their services to Rhode Islanders for free. So if you're a Rhode Island borrower, you can get Summer services at no cost to you. The program is particularly designed for borrowers who have suffered financially during the crisis. And I want to right now thank the folks at Summer for reaching out to us. I want to thank my team for working with them to roll this out so quickly. And look, right now there's 130,000 Rhode Islanders of all ages, and I mean all ages, who have student loan debt. And so for those of you in that group who have student loan debt and you're struggling financially, student loan payments are an extra burden and a challenge. And I've heard from so many of you saying, help, could you help with this? We're helping with utilities, we're helping with rent, we're helping with mortgages. For many people, their student loan payments are as big or bigger than their mortgage. I'm very pleased that the federal government has taken the important step of pausing payments on federal direct loans, but millions of borrowers and thousands of Rhode Island borrowers still have payments to make on other types of loans, not the federal direct loans. And that's where Summer can help. So for example, if you're hearing this and you're saying, does it apply to me? So for example, let's say you've lost your job or your hours have been cut back. You're probably eligible for an income-driven repayment plan, which ties your payments to your reduces your payments. If you're not making any income right now, those payments could be as low as nothing. So for someone who pays $300 a month in student loans, That's almost $4,000 of savings over the coming year. It's a lot of money. It's really a lot of money if you're out of work or working part-time or trying to live on unemployment insurance. So I would encourage you, if you're hearing this and you have student loans that are from a lender that's not the direct federal government, and you're struggling, this is for you. It could very definitely help you reduce your payments. You can access these services, which are free, at meetsummer.org/COVID relief. And all this information will be on my website too. I want to also remind Rhode Island that the Rhode Island Student Loan Authority, RISLA, is suspending monthly loan payments for up to 3 months for those whose income's been negatively impacted by the coronavirus pandemic. So that means you'll have no payments due for 3 months after your request is verified. You have to request the forbearance. To learn about that, just go to risla.com, Rhode Island Student Loan Authority. So hopefully that provides you a little bit of relief. Okay, continuing with the theme of helping folks out as we get through this to meet your basic needs. Arguably, one of the most basic needs is the need for food. And very sadly, so many Rhode Islanders are food insecure right now. So I want to again thank Rhode Island's amazing federal delegation led by Senator Reid. Thank you. The delegation has worked hard to ensure that $3 billion in funding for the Coronavirus Food Assistance Program was included in the CARES Act. And through this program, the U.S. Department of Agriculture partners with local food distributors whose local workforces have been harmed by the COVID pandemic. You should know this was a top priority for Senators Reid, Whitehouse, and Congressman Langevin and Cicilline for them to secure that as part of the CARES Act. So yesterday, our federal delegation announced that the USDA approved the application of 2 fantastic local and essential Rhode Island organizations providing food. One is Farm Fresh Rhode Island, and the other is the Rhode Island Community Food Bank. So both of these initiatives will enable the USDA to fund the sourcing, assembly, and distribution of food boxes. By the end of this month, by the end of May, Farm Fresh Rhode Island and the Community Food Bank will begin distributing 500 boxes of healthy, fresh, local food to food insecure families in Rhode Island every single week. And we hope to ramp from 500 a week to 4,000 boxes a week over the course of the summer and the fall. The Farmers to Families Food Box Program this is a win all around. We're going to work very hard this is a partnership. This is the state government partnering with the federal government, our congressional delegation, partnering with 2 fantastic, innovative nonprofits to meet the real needs that Rhode Islanders have today. The need to feed their families with fresh, locally produced food. So to all of you who worked to make that possible, thank you. And on behalf of the thousands of Rhode Island families who are going to get a fresh meal and a fresh food box, thank you. Finally, last announcement, I want to just take a moment to once again, as I've done a few times, highlight Family Service of Rhode Island. So many organizations have stepped up during this crisis, whether it's the United Way, the Rhode Island Foundation, Farm Fresh, the Food Bank, Family Service Rhode Island. You're all stepping up, and I can't thank you enough. I'm announcing today that Family Service of Rhode Island is providing home delivery of cleaning supplies and food for some of our most vulnerable families who can't afford these essentials. You know, we are up here every day saying hand sanitizer, frequent cleaning of commonly used surfaces, even in your home. Well, some folks can't afford that. And we are deeply committed to equity as we face the challenges of this crisis. And so when we say keep yourselves clean, keep your kids' hands clean, keep your house clean, we mean for everyone, so everyone can stay safe. Some people can't afford it. So we've been working with partners to help folks. And thanks to your generosity, I've been up here many times asking for donations to Family Service. Family Service of Rhode Island has been able to get these cleaning and food kits to over 7,000 Rhode Islanders. These are mostly parents with young kids, people who are isolated, folks who live with disabilities, and unfortunately, some of the most vulnerable and often overlooked Rhode Islanders. One mom who received one of these kits actually sent us a thank you note, and she said, and I'm quoting, "I just want to say thank you. I'm a single mother. I have a child with special needs. It's very hard for me to go out and go shopping. Now, because of you, I have everything I need. So thank you. And to those of you who haven't given and who are in a position to give, we need your help. So if that's you, if you haven't given and you're in a position to give and you want to help Rhode Islanders, I want you to take your phone out. I want you to text 44321. 44321. I want you to text "Be Safe" to that number. They're going to give you a secure link, and go make a donation if you can. So with that, I'm going to turn it over to Dr. Nicole Alexander-Scott, and then we'll answer questions.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. I also want to wish an early Happy Mother's Day to all the moms and families that will be celebrating tomorrow. That means those who actually are moms or have their moms, and then those who figuratively serve as mothers to many, godmothers, so many others. We celebrate all of you today with a special early message to my mom, who's in New York City, and I spoke to her on the way in as well. So she's staying safe, and that's what we're all planning on doing for Mother's Day this weekend. As I was saying yesterday, this has been an enormously challenging time for all of us. Hopefully, people can find some normalcy and joy in having a phone call with family or in connecting with family remotely in some other creative way this weekend. That's the way we can all serve to keep each other safe, especially the mothers and motherly figures in our lives. In terms of the data updates, we have 210 new cases. There are 290 people, 292 people currently hospitalized. Of these people, 77 are currently in the intensive care unit, and 56 are currently on a ventilator. We sadly have 19 additional COVID-19 associated fatalities to report. These people ranged in age from their 60s to their 90s. There were 4 people in their 60s, 4 people in their 70s, 5 people in their 80s, and 6 people in their 90s. Our thoughts and prayers are with the families of those precious Rhode Islanders whom we have lost. With the holiday tomorrow, I want to take an extra moment to reiterate some of the messages that I've shared today and yesterday. Nursing homes and assisted living facilities are not accepting visitors this weekend or on any other day during this time. We talk a lot about nursing homes during these press conferences, but it's important that people understand that the same restrictions on visitation apply in assisted living facilities as well. If there is an older adult in your life who does not live in a congregate living setting, we're also strongly urging you to not pay them a visit this weekend as well. When in doubt, stay home and pick up the phone. This is not the time and not the weekend to be getting together. We know how challenging this is. We're only taking this approach because it is in the best interest of the health and safety of individuals and of our community as a whole. We are continuing to explore ways to help residents and families connect creatively. Around Easter and Passover time, we were encouraging people to not send flowers and packages to their loved ones in nursing homes and assisted living facilities. As we move in the direction of very slowly loosening some of our restrictions, we are working with nursing homes and assisted living facilities to allow things like packages and flowers to be sent to residents. This will be done with some very specific safety measures in place. For example, packages that get sent would need to be held by administrators for a period of 24 hours. That time period is based on some preliminary science on how long the virus can remain on a substance like cardboard. I just want to reiterate that you should not be bringing packages to nursing homes and assisted livings yourself this weekend. You should not be going at all. That means don't even go to the window, please. Your presence there in any way makes things much more confusing and challenging for everyone. The staff and administrators at nursing homes and assisted living facilities are doing their best. We really need families to be supporting them right now as they're supporting your family members. We all know that congregate living settings have been challenging environments when it comes to COVID-19 in Rhode Island and across the country. But the difficult scenarios that have played out in Rhode Island facilities are in no way the fault of those facilities. To help really illustrate this point, we at the Rhode Island Department of Health have had a very strict infection control program in place for a long time now. That includes the masking of all of our employees and checkpoints at all entrances where people are asked about any symptoms they may have. And yet, we have had cases of COVID-19 within our Rhode Island Department of Health family this week. This is because people can be positive for COVID-19, as we're learning, and not have any symptoms at all. That's what's making this virus so challenging. After one staff person got a positive test result just a day or two ago, we coordinated some testing for staff. We found out late yesterday that an additional 6 people were positive. All of these people are at home isolating, and their contacts are self-quarantining. Out of an abundance of caution, we are having a thorough environmental cleaning done of the entire Cannon building today, which is the larger of our 2 buildings at the Rhode Island Department of Health. I want to be clear and really acknowledge the fact that this is not in any way interrupting our COVID-19 response. We have done extensive planning and have worked closely with the state's IT department leadership, and I really want to thank BJ Kumar, Chirag Patel, Bob Childs, and the entire IT team that have done an amazing job to ensure that people are able to continue working remotely and even to accelerate the process that we have been preparing for. We've been encouraging offices to use technology to allow business to continue as usual with people working from home. If you can work remotely, you should continue to do that during this phase. We at the Department of Health are just like any other office-based organization in that regard. I did want to make one last note. We had said that our beloved Dr. McDonald was going to be joining the governor today, and I'm here. Dr. McDonald was one of the people at the department who was tested. His test result is negative. It came back just a short while ago. But because of what I've been sharing about our testing, we know that a result done on a person without symptoms is less reliable. So we will continue to ensure that all of our staff are wearing masks, that we're screening for symptoms, and doing the important work that we're asking everyone throughout the state to be able to do. So I'm happy to report that he and all of our team will continue forward with being able to provide the excellent updates that I'm able to share today. With that, we'll get started with questions.
Good afternoon.
Hello, good afternoon.
We're going to begin with Michael Bilo from Motif Magazine. He notes that Rhode Island successfully flattened the curve to a plateau where hospitalizations and fatalities have stabilized. But what is the plan to bring down the numbers? The 7-day moving average of deaths is a steady 10 to 15 per day for over 3 weeks, which is obviously not sustainable indefinitely.
Yeah, so a few things. Hospitalizations are down. They are coming down, thankfully, especially over the past few days. Secondly, you have to account also for the number of tests, which is why yesterday I referenced the percent positive. So a few weeks ago, our percent positive of the number of tests we've done, our percent positive was much higher than it is today. Having said that, you're right. As I've said so many times, we are not out of the woods. We have not rounded the curve and started to come down, as you say. So what's our plan? Our plan is to go slow. You know, our plan is social gatherings limited to 5, wearing your masks, doing everything that we've learned how to do. But that's exactly why, you put your finger on exactly why I'm imploring the people of Rhode Island not to go too fast in this first phase. The risk of going too fast in the next couple of weeks is enormous. We risk going backwards. So let's go slow. The plan is to go slow and steady, to test our systems. You know, you just heard from Dr. Nicole Alexander Scott. That's going to happen. We will see outbreaks at different office buildings, manufacturing operations, congregate care settings. We can't really stop that from happening, but what we can do is make sure our system is strong enough to get there, test people, do what we need to do, get people into isolation. So anyway, I feel absolutely confident that we can lift the stay-at-home order. We're still building our systems. We haven't rounded the curve, and so I'm asking you to go slow and follow the rules.
Our next question is from Tara Granahan at WPRO Radio. If people can't pay utility bills for the next 2 months, do those bills carry over or are they forgiven?
Yeah, they will carry over. Thank you. Unless they make further announcements. But as of now, it's only intended to give you relief, but that could change.
Paul Parker of the Providence Journal asks, what has been the survival rate of COVID-19 patients on ventilators?
That's an excellent question. We certainly know that people who are in the hospital and those who are in the ICU and ventilated automatically have a higher risk profile that led them to be there, and that unfortunately does increase the risk of people who aren't able to recover. But our first case in Rhode Island did get hospitalized, was in the ICU, was ventilated, and did recover. So it definitely is possible. I would have to look through the numbers to get you an exact amount. Our data team does a phenomenal job, so it will take time to pull that together, but I wanted to give that overall response.
Our next question is also for you, Dr. Alexander Scott. The average age among the 4,420 people who have died of COVID-19 in Massachusetts as of Wednesday was 82. What is the average age of people who have died in Rhode Island, higher or lower? This is from John DePietro.
I can give numbers. It's around the same amount. 24% of the people who unfortunately passed away were between 70 and 79. 32% were between 80 and 89 years of age, and 23% were between 90 and 99 years of age. And that's the largest proportion of all people who have sadly passed on.
Thank you. Our next question is from Richard Asanoff of Convergence RI. The Rhode Island Innovates 2.0 strategy released in January, a report on Rhode Island's future innovation economy, did not include strategies for investment in public health infrastructure, such as HEZs. How has the pandemic changed your assumptions about such investments to spur the future Rhode Island economy?
It's a fantastic question. And that's exactly what I mean when I say we're going to come out of it stronger than when we went into it. So in the process of standing up our economy, again, we cannot just look to do it exactly the way it was, because obviously we need to be more resilient. We need to be more technology enabled. We need to be more digitally literate. We need to invest in public health. We need to make sure that everybody has access to public health. We need to reduce our dependency on communal living settings for those who are sick. We need to train people. I mean, the very saddest part about this is that the people who are hardest hit are those who are the lowest skilled and the lowest paid. And very sadly, I worry some of those jobs might not come back. You know, if you think about, say, certain sectors. So we need to get serious about making investments in our healthcare, in our infrastructure, in our job training, so that A, we can get everybody back to work, and B, we have a stronger system on the other side of it.
Our next question is from Ian Donis of the Public's Radio. To what extent is there any sign of adverse long-term health consequences for the Rhode Islanders who have recovered from the virus?
We are still learning. As of now, we have not seen any particular trends stand out in terms of health consequences, but nationally and internationally, we are all going to learn together, particularly with the countries that are ahead of us in terms of recovery and being able to see how people are doing for the long term. We hope that it will be similar to what we see with other viruses similar to coronavirus, where in the long term, people ultimately do well.
Our last question for this Saturday briefing is from Nick Papadilla of ABC 6 News. Will those who have underlying medical conditions be required to go back to work once their place of business reopens? If exceptions will be enforced for those with these conditions, will those individuals still be eligible for unemployment benefits? And will this include gig economy workers?
The second one.
Yeah, okay, sorry. I apologize. Will the underlying medical conditions be required to go back to work? Yes. And will exceptions be enforced for those individuals? Yeah, okay. So here's how to think about it. Folks who have symptoms of any kind, who are sick, should not be allowed into a workplace. That is the responsibility of the employer and the employee, but the employer, in order to reopen any kind of business, has to have a screening ability so that nobody comes into the office or factory floor or store sick, fever, aches and pains, etc. For those folks who are in a higher risk category, maybe older workers, maybe those with an underlying health condition, they're going to have to work that out with their employer. So employers should take that into account and should make extra accommodations as necessary in order to make sure that folks can continue to work and earn an income, but also that they are protected. There should be absolutely no discrimination, and we are going to have our eye on that, and we're in close touch with the Attorney General. This is a time for the whole country as we go forward. We need to take extra care for those with underlying health conditions and who are our older workers, that they cannot be discriminated against. And so that's going to take some figuring out about how they can be accommodated and cared for, but not discriminated against. The gig economy workers, that unemployment insurance falls under the pandemic unemployment insurance, which is all driven by the federal government, and it'll be up to Congress to decide if and how long that initiative will last. You know, we're going to be advocating that they continue to take care of, frankly, I think on a permanent basis, I would say, gig economy workers, because they ought to be eligible for unemployment just like anybody else is. Thank you.
Hi, everyone. It's Jen Bogdan. We're here with the governor, Dr. Alexander Scott, and Director Smiley. We'll take your follow-up.
The conference is now in silent mode. The conference is now in talk mode.
Dr. Alexander Scott, this is Kim Kalunian. I'm just wondering if you've been tested for COVID-19 as well.
Not yet.
But you plan to be?
For this time, yes.
Thank you.
And what about you, Governor?
No. Turns out I haven't been near anyone who's tested positive. I'm keeping my social network very small.
Are there efforts to contain the possibility of infection at the State House? Because, I mean, with the White House now having 2 confirmed cases, I would think that's some concern. This is Michael Billow from Latif.
Yeah, so here at the State House, everybody is screened, myself included. When you walk in, you can't get in the building unless you answer the health questions. We have a mask wearing policy, and frankly, great credit goes to our legislature. They're doing the right thing, and they're not here during the crisis. So there's very limited number of people here on any given day. And we've instituted a whole new cleaning protocol. So, that's how we're dealing with it.
Hey, Governor, this is Eli Sherman from Channel 12. I'm just wondering, maybe another couple weeks before we know exactly what lifting the stay-at-home order will have done in terms of hospitalizations and testing and that type of stuff. Yeah. But is there something that you're watching in the more immediate term to try and measure whether or not things are?
I'm sorry, Eli, you just cut out at the end. Is there something I'm watching?
In the immediate term, to measure whether or not things are going south?
Well, we'll look at number of cases every day. That's a leading indicator. If we start to see a jump in percent positive or, a surge in number of cases, outbreaks, like if we start to see, if everybody, goes to the office and then not supposed to, we're going to see outbreaks in offices and such. If we have a series of those, that'd be pretty obvious. And then we're going to be doing enforcement. So we're going to really step up our enforcement. So we'll be out and about watching our people obeying the new rules. But you're correct in that the most definitive indicator is the lagging indicator, which is hospitalization.
Tara Granahan, if I could.
Go ahead, Tara.
If Dr. McDonald was around people who tested positive, and thankfully he's negative, but that's in the surroundings, I would think, of Dr. Nicole, and then you guys are together every day, should you not be testing just to make sure?
We would want to base it first. As the governor said, she has not needed to be tested because she hasn't been around anyone who's tested positive. So the key would be to follow the approach in terms of exposure. So we have said anyone who has been in our building and affiliated with the areas involved should be tested. And I have been working from home primarily, so the risk for me has been low, or working remotely. I do want to add to Kim's question who had asked that I've been tested. I had not been tested for this evaluation as of yet, but do plan to, because I have gone into the building at least once within this last week. But I had been tested several weeks ago because of an exposure at that time. So I just wanted to clarify that answer.
And the governor's you've never been tested at all?
No, not yet.
Okay.
Governor Bill Bartholomew, I'm wondering about this protested schedule for Monday. Last time, there was no enforcement really. I wonder if you have any plans to do anything differently. I understand it's a car protest, but this time there are members of the media that are pushing it. It seems like it's going to reach more people. What's your message to anyone that plans on turning up on Monday at the State House to protest your guidance?
I would say two things. First I would say I respect your opinion, and these are difficult decisions I'm making. It's not like I want to keep people out of work. I feel it's the best of two bad options, and it's certainly, I'm certain it's the right thing to do in light of everything. Secondly, I would say, if you want to protest, stay in your car. Protest, honk your horn, make your voices heard, but don't violate social distancing. And thirdly, I trust Colonel Manny implicitly and totally. He and his troopers will be out there, and if they feel, I'll trust them. They'll de-escalate the situation, but they're on guard and they will enforce the law as they see fit.
But have you had any conversations that since the last protest? I'm sorry to interrupt. I just want to keep the question going. Have you had any conversations with Colonel Manny since the last protest that there may be a different approach to that enforcement this go around?
I have not talked to him about it. I probably will between now and Monday. But again, that's his area, and he will have to balance keeping peace and de-escalating tension with making sure that the social distancing rules and mask wearing rules are enforced.
Governor, I'm struck by there are good trends on hospitalizations and cases, but the deaths, we went from 300 to 400 in less than a week by my math, which is the first time that's happened. Do we have any, this calls for you, Dr. Alexander Scott, why, deaths, I know they're a lagging indicator, but why they'd be picking up even as we see some positive trends on hospitalizations and cases?
We are definitely identifying more cases because of the aggressive testing and assessment we've been doing, particularly in our congregate settings. So that then leads to association of COVID-19 with the deaths that are unfortunately happening. And that may be a contributing factor to why we are seeing these numbers, particularly in that higher risk population.
Director of Health, this is Ryan Belmore.
Follow up on my
question.
Go ahead, Ryan.
I want to follow up with Dr. Scott. I'm just curious. So, Massachusetts, the average age is 82, but we don't know what the average age is in Rhode Island for all the people that have died.
I can get you the actual average. I was, serving to give you even more information than that by reading through the percentages that I shared. But we can calculate the actual average, and Joseph can get it to you.
It was just, I want to clarify, it was my understanding, and you were giving percentages, but I thought that was just for that one day. But on Wednesday, I thought it was through the Massachusetts Department of Health, but they released the average age of 82 for all of the people that have died, not just on one day.
Yep.
So that's the number that I was looking for.
Yep. The number that I gave was for an N of 341 fatalities.
Okay.
So a larger percentage.
Okay.
If you do release the mean age at death, I would be interested in the median age at death as well, if that's easily produced.
Joseph will get you guys that later today.
Thank you.
Director of Health, Ryan Belmore here. I have a question. We have two supermarkets here in Newport, which each have had at least one employee test positive at each. What does contact tracing look like for supermarkets? We have a lot of residents and customers worried. And also, what does testing look for the employees at those businesses?
Yes, for each entity, it may vary slightly, but the big picture in terms of the contact tracing component is identifying contacts who have been closer than 6 feet distance for 10 minutes or longer. So that's what's described as prolonged direct contact. That tends not to happen as much with customers in a store, but we do walk through that with employees to help get that understanding and reach out to those who are considered contacts.
From the testing standpoint, with the testing strategy that the governor has shared and I have relayed, we are continuing to take a more targeted approach, particularly with our outbreak response, similar to what has been described with congregate settings where we have a couple of cases and we can put a team in to do more extensive testing and better understand the landscape. We want to do that in work settings as well, and it's similar to what I described that we did at the Rhode Island Department of Health. So those are the high level approaches, and then there will be nuances based on the individualized information we obtain.
Governor, can I ask a question with the DLT? With the there's a tremendous amount of people still writing and calling in and asking for help, and I can only speak for myself. But you try to direct them to the right phone number or the the right email address, and there's still an awful lot of it out there. Has there been any streamlining? Has there been any beefing up of moving state workers around, or what's changed at all to try to get all these unemployment claims in?
Yeah, there has. We've changed the technology and also the workflow and added more people. The volume is, I mean, it's like nothing we've ever seen before. The systems aren't built for this kind of volume. I feel sorry that we can't move faster. Comparatively, we're doing a much better job than Massachusetts, for example, and most states. But Brett, maybe give some details.
Yeah, I would just add that we have reassigned state workers. We have an additional overflow call center in place. And then we implemented a brand new back-end technology system specifically for the Pandemic Unemployment Assistance, the PUA, that has enabled it to run smoothly. For the average claimant, it's all hinged on whether or not there's an exception to your file or not. If you complete everything accurately without any flags, you're still paying within 10 to 12 days. However, if there's a social security number that's off, an employer that's off, an income amount that's off, that then gets handed to a live person, a state worker who has to make a phone call, and that is almost every time where the delay comes in.
Yeah.
Okay.
Director, can you give us an update on the
questions from a few people that have wondering about incentives for installing PPE-esque, like whether it's a glass shield in stores, small businesses here in Rhode Island that are doing COVID preventative work. Is there any incentive for them, whether it's a grant or anything of that nature that you're aware of?
Well, I'll answer that as the gov. We're working on it. We're trying. That's exactly the sort of thing that the emergency COVID relief fund was intended to help governors do. So I'm hoping to have more to announce, I don't know, in a week or so. I know we need to get immediate relief to small businesses and folks who are unemployed. So just give me another week.
Of course.
Couple minutes left.
How has the testing at the Stop and Shop locations been going throughout the state?
It has been going well overall. We are working closely with Eastside Clinical Lab, who provides the results and remain available to people who have questions. And it's really the first step in that third approach for a comprehensive testing strategy to help us understand what spread of disease or just COVID-19 looks like in Rhode Island, particularly throughout the population that may or may not have symptoms.
Have you been seeing a lot of people get testing there compared to other sites that are already set up, like the CVS Rapid site?
Well, the approach for this is different because people were randomly selected and reached out to with the offer to get tested, as opposed to those other sites that you mentioned where we are strongly encouraging people and their providers to send persons who have symptoms to be tested. As soon as any symptoms occur or a question of symptoms, we want people going to the current swabbing sites. The Stop and Shop component is a very different approach. This is more so for just the population level understanding of how COVID-19 works. not focused on people who we want to get the immediate care needed because of symptoms.
And Doctor, what's the percentage of people who are offered the testing who have accepted it for that sample?
We're still collecting that data, but we'll make note of that and be able to share it when we have it.
Can you give us an update on the deaths in terms of how many of them happened in nursing homes? And can you give us any update on the veterans home, please?
The most accurate nursing home numbers we've now been posting weekly as the weekly data are cleaned and validated. So any daily numbers.
I meant today's death, Director, sorry.
What'd you say?
Today's death.
I understand.
Yeah.
The daily numbers that I provide should be considered a provisional snapshot. So of the 19 fatalities that were announced today, 17 were associated with long-term care facilities. We approximately have 320 fatalities total associated with long-term care facilities or assisted living facilities, and there have been between 5 and 10 fatalities associated with other congregate care settings. And that's also in the context of what I shared previously about our overall mortality rate as a state.
All right, thank you, everyone. We'll see you Monday.